Bismillahirrahmanirrahim. Assalamu alaikum dear viewers. I am Professor Dr. Muhammad Usman, and in this video we will learn about sleep apnea. So this is the outline of today's video about sleep apnea. Now sleep apnea means absence of spontaneous breathing during sleep. Okay, it means absence of spontaneous breathing during sleep. While the sleep apnea syndrome is defined as frequent episodes of apnea and hypopnea, okay, frequent episodes of apnea or hypopnea associated with symptoms such as excessive daytime sleepiness and cardiovascular morbidity and mortality. Episodes of apnea may last for 10 seconds or longer, and typically they occur from 300 to 500 times per night. Now various risk factors for sleep apnea, these include narrowed airway, okay, excessive weight, male gender, chronic nasal congestion, hypertension, and family history of sleep apnea syndrome. Now there are two major types of sleep apnea, that is obstructive sleep apnea, and as the name indicates, it is caused by blockage of the upper airways. Now this blockage of the upper airway, it may be caused in many ways. For example, in older and obese persons, there is increased fat deposition in the soft tissues of the pharynx. Then normally during sleep there is decreased tonic activity of the laryngeal, supraglottic, oropharyngeal, nasopharyngeal and lingual musculature, which can result in dynamic collapse with the respiration. So this collapse will increase the resistance in the upper airways and will produce sleep apnea. Then in some patients there is chronic nasal obstruction, some patients have larger than normal tongue, some patients have enlarged tonsils, and then certain shapes of the palate, they also can cause obstructive sleep apnea. Now the second cause of the second type of sleep apnea is central sleep apnea, and it occurs when the impulses from the respiratory center to the respiratory muscles, impulses from respiratory center to the respiratory muscles are transiently abolished. In this case, usually there is damage to the respiratory center. Now let us see what are the various clinical features of the sleep apnea. These include daytime sleepiness, loud snoring, coughing, choking during sleep, frequent morning headaches, and then some less common complaints include difficulty remaining asleep, chest pain or palpitations, some neuropsychiatric changes and nocturia. Now can you please tell me what is meant by Pickwickian syndrome? You can give your answer in the comment section. Now the diagnosis of sleep apnea, it depends upon detailed history and examination, and the workup should be done in all the patients who have excessive daytime sleepiness and two or more of the these symptoms, that is diagnosed hypertension, loud snoring, witnessed apnea or gasping or choking episodes during sleep. The gold standard for the diagnosis of obstructive sleep apnea is an in-laboratory polysomogram, as you can see in this figure. Then the treatment includes treating allergies if there are any, jaw surgery if it is recommended, then circular breathing techniques and weight loss if it is accompanied by hypertension and obesity. Then continuous positive airway pressure therapy is also beneficial in many patients. Hope you would have learned something about the sleep apnea. Please subscribe to this channel. Thank you for watching. Stay blessed and Allah Hafiz.